Hello, everybody, and welcome to another exciting episode here of Education with the Functional Medicine Mastermind Summit. I'm Dr. Melissa Grill-Petersen, your host, and I'm proud to be joined today by James White. He's the founder and CEO of KBMO Food Sensitivity and Diagnostic Testing. James has been in the industry for over 20 years, both stateside, and globally, launching a wide array of diagnostic products and services ranging from the cardiovascular arena to multiple molecular diagnostic services. It goes deep and it's too much for me, but that's why he's here, and we are so excited to have you, James. Welcome.
Thank you, Dr. Melissa, for that very kind intro.
Not to cut your credentials short because they are vast, but it's just letting you all know when we get into the molecular diagnostics, it's like, okay, that's why James is here with us today, because I'm not going to try to tell the story. I'm going right to the expert, and that's you. And, you know, James, we're really excited to have you as one of our sponsors at the summit because you have really been, you've been on everybody's radar. KBMO has been kind of fast-tracked. Obviously everybody knew ALCAT. That's kind of where the industry standard for so long when it was food sensitivity. And then, of course, there was so much, just so many, what do I want to say, different opinions about the validity of the ALCAT test. So many things began to be called into question. And, of course, insurance and everything. And then all of a sudden we start seeing other food sensitivities companies out there. And like I said, you guys have really been fast-tracked. So we're excited to have you. And I've got lots of questions for you. So give us a little bit about your history and your story. How did KBMO get to where it is today here in the States and really being one of the leaders with food sensitivity diagnostic testing?
That's great. And as I say, thank you again for the intro. I mean, where we started off was my background, as you mentioned, I'd looked at cardiovascular, molecular, and really leading into that area of kind of personalized medicine. And as I kind of looked at, where I wanted to head next was, as I say, we've done a lot of work in the cardiovascular area, and many physicians were, looking at, how do you personalize results more so that, the patient can really feel like, they didn't just get their 7 minutes of fame with the doctor. They got something that was really, really important to them as an individual. And so, when I looked at the, and most cardiologists, they'll say, look, exercise more, eat less. And so when I looked at that eat less piece, it seemed that there was a real, gap in the market to come in with an ability to say, look, how can we come up with a test which looks at, an individual, a bio-individuality in terms of the way you get your results by looking at 132 different foods, colorings, and additives, and giving it in a way that, really looks to really mimic the human body. And so what I did was I looked at the space and was fortunate that I partnered and ended up acquiring a business called Brendan Bioscience, which was developed by a gentleman called Dr. Brent Dorval, who is the scientific founder. Brent's many claims to fame, but one of them was he invented the first HIV diagnostics. So with his infectious disease mind, he really had a good understanding of inflammatory responses. And so what he did was 10 years ago now, or probably a little longer, he set up Brendan, which was looking at how do we get involved in this food sensitivity area, but with a good basis of science that can then be really backed up as we roll it out across not only the US, but internationally now as I've looked to take it on. So I got involved 3 years ago, and really one of the key things that we did was we took the test, which is now called the FIT test, the food inflammation test, and really try to look at, how does that differ and how is that different from some of the other options. So there was, as you rightly pointed out, Melissa, there was a number of people looking at just IgG. There was ALCAT looking at the swelling of white blood cells. And so what we looked at was, why don't we come up with a test, and this is where Brent's, real brilliance came through, was that looks at mimicking the human body. So how can you look at a test which has multiple pathways and really hones in on really the key foods that are causing the patient the issue? Because again, many practitioners will say, I used an IgG or the ALCAT and 30 or 40 foods came up. So from a compliance and frankly a red face test, how do I really tell that to a patient? Go and remove 40 foods from their diet. And so I think really the great thing about what this test does is it looks at multiple pathways. So we look at IgG, but we also look at complement through the C3D marker. And so what we've done is we've developed an assay which for each of the 132 foods, colorings, and additives that we test, we measure the C3D as well as the IgG. And what that has enabled us to do is really what we've done is, if you think about as the food passes through the tight junctions of your stomach into the bloodstream, a number of things happen. So rather than just look at one pathway, we're looking at these multiple pathways. And that's enabled us to have a much more specific and accurate result than some of the others. So we typically see in the range of 5 to 15 foods. And again, by measuring these multiple analytes, that's enabled us to really, from what we hear back from our clinicians, really hone in on the foods of interest. So again, I guess that's a bit of a kind of potted history of how we've got there. And as I say, what we're hearing back from physicians is that multiple pathway approach, has resonance in terms of, it's logical by mimicking the human body, and they love the fact that we're looking at 132 foods, colorings, and additives. So again, it's a broad enough spectrum to really be able to give them a good sense when they go back to their patients of, look, this is a good cross-section of foods. We also look at candida and yeast and things like that. So again, it's one that they seem to really be having great results with, and very, very, very positive feedback that both Brent and I get when we either when we're out in the field talking to physicians or when they're calling in.
Well, and I'll be one of those saying absolutely, because I've worked not only with your test, but several of your competitors over the many years in practice. And again, one of the reasons that I really sought you guys out, because it was a notable difference before. You're right. I mean, I can't tell you how many times I would sit and eat and meet with a patient and have to deliver their food sensitivity results and see them literally shut down. They went into such overwhelm. It's hard enough to think I can't eat my favorite foods, but then when you think I can't eat my favorite foods, nor can I eat anything else that I even remotely liked, because they're all on this test, and then there's false positives, and depending on how inflamed they are already coming into you, because of course, many patients walking in to functional medicine practices, primary care, any type of just really practice out there today, so much of what we're dealing with is chronic disease, which means chronic inflammation. And so when we personally started utilizing the FIT test in practice, it was phenomenal, because it was a lot easier. It was a lot more manageable, and I didn't see as much overwhelm from the patients because it wasn't a long laundry list. So I can absolutely verify that, yes, the things that you're saying is true from a practitioner standpoint, and watching what it's done for my patients. We've even, my husband and I have utilized it, and it's been great because he had some other testing done, and it made it so much simpler for him. And he's able to wrap his head around 6 key things versus 16, 20 key things. So it's phenomenal. It's a great tool. So let's talk about, you're seeing it. Thank you for giving us that history, and because you did a great job of very succinctly helping us to know one of the key differentiators for you guys, and I love the technology, is you guys said, hey, let's look at something that mimics the human body. And I love that I'm hearing that you're saying we're not looking at just one pathway. Because all of us, especially in the land of functional medicine, we understand, every system is interconnected, and there's not one system, there's not one thing that's going to restore the overall health of the full system. So when you're looking at multiple pathways that really mimics real time, physiology, that's really, to me, from where I sit, that's your competitive edge. That's what makes you guys so different.
Yeah.
And I love it.
And I think the other thing I would add is certainly, with our, infectious disease background and DNA in terms of from Brent, what that means is, clearly when you're coming up with an HIV test, you have to be highly accurate, specific, and very sure on your results. And I think how we've managed to kind of portray that in what we do is, you'll see a lot of tests out there which are looking at 96 foods. And the reason they look at 96 is because there's a 96 wells on an ELISA plate. And so what we do is, but it's very difficult to then see where you put your controls and standards. So what we do is, with the 132, we run those on 3 ELISA plates, And again, as someone pointed out to me, that means you should be able to do a lot more than 132, James. But in essence, what we've done is we've then been able to run standards and controls on each of the 3 plates. Because again, one of the things I heard as I got involved in this industry was, you could send a sample in and it wouldn't be reproducible. And so again, I think one of the things we've been very, again, blessed through Brent is having that background of making sure that, we have a highly reproducible result by being able to, check that by having standards and controls on each of the 3 plates that we run per patient.
I think that is absolutely brilliant. And let's talk about this for a minute. Let's talk about that C3D marker, because now when we're getting into looking at some of these complementary pathways, when we're looking at it from more of a genetic type of component, what does that mean in the land of insurance, especially? Because obviously there's a lot of practices, and we'll talk about this in a minute, that are cash practices utilizing food sensitivity testing. But there's also still a wide array of practices that accept insurance that want to utilize food sensitivity, but because of the way it was not so, it really got taken advantage of, I think, over the past decade. And of course, the insurance companies have really cracked down, and they're saying, hey, this is, they won't cover it. Fewer and fewer companies are covering any type of testing, but there still are some companies that are, and there's certain ways that you can get that covered. And does the C3D marker have anything to do with that? Can you speak on that a little bit?
Yeah, absolutely. So again, that enables us to get good insurance coverage, and typically, it's for patients with out-of-network coverage and with a PPO style plan. It's obviously quite difficult again as that whole insurance landscape continues to kind of be more and more complex. But generally, that's the advice that we give to practitioners. And again, I think what we've seen is good levels of coverage around that kind of criteria. So as I say, I think that's certainly a benefit in terms of being able to give that offering, because as you say, lots of patient comes in, you want to give them a battery of tests. If you can find some that not only give you a great result but also have that added benefit of insurance coverage, then we're obviously seeing that's been hugely beneficial as we roll the test out really across the nation.
Fantastic. So let me also ask you this. What would you say to the practitioner who's maybe not currently utilizing food sensitivity results? What can it do? Why should they? What could it potentially do within their practice as a viable service center?
So again, the way someone much smarter than me explained it to me one time is that if you think about it, when you go and buy a new car, they tell you what gas to put in. So if you think about it, as your body as an auto engine, you want to understand what are the right types of fuel in terms of food that you put into your body on an individualized basis. And so I think as you look at it from that perspective, for the patients that are coming in who just aren't feeling great, it's pretty difficult to kind of get a good diagnosis in the ER if you don't feel great. Pretty simple if you've got a broken arm. So this is a really good test for enabling you to get through to some of those really difficult patients in terms of that have got non-specific kind of autoimmune type symptoms, tired, that kind of thing. So this, what we've seen, from or heard and been fed back by practitioners, that this was a really good tool, to help them kind of get to the heart of the issue with some of those patients. And again, to be fair, what we always say to every practitioner is, look, this is a great tool, but it's a great tool in the hands of good practitioners. So, it's not an elixir of life or anything. It's another piece of the jigsaw that I think is an important one as you try and help, to get to the root of the problem. And as most functional practitioners will attest, unfortunately, they're not the first practitioner that many of these patients have been to. So again, it's trying to get to how do you get to the real heart of the problem. And again, I think via this testing has proved incredibly effective and helpful in terms of the practitioners, in terms of getting solving some quite complex issues by trying to almost demystify it by at least addressing this issue and and coming up with what at least fuel is that each individual patient is on, and can you adapt that to make them to change? And I think that's what we've seen by having a fewer number of foods. People are more willing to kind of grasp onto that and try and take control of their own health.
I love it. And to that, a few things. Part of your initial vision was you set out to answer the question, how do you personalize results? And so this is a tool that truly does personalize results. Whether the patient likes the answers they get or not, that's a different story. But
exactly.
Here's the truth for your body. Now at least we know where to begin. And, as you said, again, with your background, with your team, in infectious disease, we understand so much, and you just mentioned it, that autoimmune type of thing, those kind of generalized symptoms, that's not that clear diagnosis of a broken bone. It's saying, what is the root cause? And of course, what we understand is that we have to begin to look at what's impacting physiology, what are the factors that could be contributing to that inflammatory-based response. And so when we think, we have to go, okay, environment. That's what, science is telling us. We understand that the environments that we live in, how we eat, breathe, think, move, and respond, and, what we're taking in and surrounded by impacts our physiology positively or negatively. And we're all eating at least 2, if not 5, 6 times a day. Ideally, we want to be eating at least 3 solid meals a day, right? And so this becomes a powerful place to begin to make immediate shifts and change and engage that patient. And engagement is so important because in traditional medicine, engagement isn't a key piece, which the patient is left feeling like a victim and hopeless and no direction. But when you begin to give them tools, and yes, you said it's not, this isn't the end all be all, but when you give them tools that are personalized, well, now you engage them. Now they begin to feel like a part of the process. And now they begin to feel like they have some semblance of control in making choices. What's going to help to make me healthier? What's going to help to make me sicker? And so at the end of the day, it's their choice, but tools like this are really, really valuable. Now, of course, part of the summit, James, is based on business and marketing. So I wouldn't be a good interviewer and host if I don't talk to you about the business side. So of course we as practitioners want to do what's best by our patients to get the best type of results and give them tools that are going to actually make a difference. But talk to me on the business side. What can a test like this do from a cash flow standpoint? How can something like this add added revenue, if you will? Kind of what type of profit margins are we looking at?
Yeah, I mean, as you say, we typically are looking at kind of more of the insurance model. But again, sometimes the way we look at it from a for a cash flow for a practice, it could also be in terms of you've got these very clear results for this patient in terms of now what does that mean maybe from supplements in terms of right. So we've done this test, we've got some clear guidelines. Maybe it's they need to go on a yeast cleanse. Maybe right. They've got high levels of inflammation. They need to look at omega-3. So I think it's again, another neat way of saying, look, from a personalized perspective, this now gives us a clear route into what we could, potentially be looking at some supplements and other elements as well. So rather than just think it's a closed-end sale, it's an opportunity for the practitioner to look at some of those elements as well. Because again, more and more practitioners have their own supplement lines, and so again, it's a way of trying to have some more joined up thinking when you're looking at doing when you take this test to follow it on, and then hopefully to get them feeling much healthier anyway.
I love it, and it's true because it's definitely. If you're in a cash model, to all of our audience out there, if you're in a cash model, again, it becomes a very important part because one of the things I see a lot of practices do, because we've all kind of been raised with this school of thought, is we put all the power in the test. And we don't put any of the power in the follow-up, in the actual correction of the problem. We do a lot to identify the problem, but not nearly as much to correct it. And so what I love that you just said, and I want to reinforce so people are really hearing it, is this test is a great identifier of the problem, but the opportunity within the practice exists to now, based off of this test, create the ancillary products or services that provide the solution based around it. Okay, because sure, you can identify that people have a gluten issue. And it's the same thing as if the doctor said, okay, eat less and go exercise more. Okay, well, what foods do I eat less, and how, and what kind of exercise do I do? Okay, now we've identified that you shouldn't eat gluten. Well, how do I do that, doc? What the heck is gluten? I mean, that's like one of the biggest, people don't know. I've literally had patients say to me, oh, I stopped eating white bread. And I was like, okay, note to self, I clearly didn't do a good enough job, and or they weren't fully hearing the explanation of what gluten is. So, this is a tool, but it's not where it ends. So again, begin to think from a business standpoint. As the practitioner, what do you do in your office, and or what referral relationships do you have potentially built with other providers, maybe in your clinic or in your area, that now becomes a revenue source? So again, more products. Is there coaching? Is there a nutrition program? Is there a shop, how to shop for these foods? Maybe you're offering shopping classes. And at the summit, we're going to be talking about all of this. We're going to really give some live examples. We're super excited because it's a really viable component, I think, I don't think it matters what type of practitioner you are. We all are eating, and our foods are either helping to make us sick or they're helping to make us healthy. And when you can really customize and personalize those results, you just help to improve the outcomes for the patient, which means they're getting better results through you as their practitioner. So sorry, James, I just had to run down the rabbit hole with that one for a second because I think it's an important point, and you did a great job of setting that up. So the last thing I'm going to ask you, and then I'll let you go because we're going to get to see you at the summit. We're super excited. You're going to be there with the KBMO booth. I know Dr. Jill Evans is here talking and really, sharing some knowledge with us, and he's just such an icon out there. We're so excited to have him as well. But you did mention most of the practices that are utilizing this testing are insurance. And so, and I'm not asking you to give dollars and cents, but are you seeing it from what you're finding out from your practitioners utilizing it across the country, that it is, that it's really a successful piece and that they are getting good reimbursements, they're getting, regular reimbursements? Or are you finding that there's, hey, it's a 50-50, there's a lot getting denied and, and then people have to go to the cash? Tell us, just pull back the curtain. Give us the pros and the cons if we're in an insurance model to billing this type of test.
Yeah, I mean, I think, it varies obviously in terms of the practices, population in terms of the type of insurance that they have. But generally, as I said earlier, the key is, if they've got PPOs with out of lab network benefits, then I think we're seeing a good response and hearing a good response in terms from the practitioners that we're working with. So I think it's right. As I say, because of that landscape's becoming I guess murkier and murkier, just from the perspective of every year, whether it's deductibles going up, there's lots of different things that seem to be changing. But I think on the whole, I think we haven't, the guys who are enabling us to do the insurance for them are pretty happy with the outcomes that they're getting, and the model seems to be working very well. So as I say, we haven't yet seen any issues with that, and so again, we don't expect to either, given I think the good clinical outcomes and results that we're hearing right across the board.
Fantastic. I love it. I love it. I love it. This is all so exciting. One more thing, because you're going global now, you with this, and of course you've been in the global market for so long, but just from your perspective, because yes, healthcare is, we don't know what it's doing from day to day, right? We're all in this kind of turbulent and evolving landscape, which is exciting and scary as hell because we don't know which way it's going to fall. But what I love is, and even the purpose of the summit, is to continue to bring together thought leaders and innovators that can see a better way, a clear way. But talk to me from your perspective, the events you've been to, doctors you've talked to, out of the country. What are some trends that you're seeing more and more of kind of across healthcare delivery systems as a whole?
Well, I think it comes back to that, the personalized nature of it. I think, people are wanting information, which is now much more pertinent to them. So I think in the days of, the great news is there's so much information available to people. And so I think, people are trying to take much more control of their healthcare outcomes. And so as part of that, across, globally, people are looking for opportunities, where is there information that, this doesn't just mean, this drug means, if I take this drug, it one size fits all. I think, that model has probably been, there's not many people who still believe in that. So I think that's what you're seeing from the patient end, or what I hear from physicians is, look, patients are looking for results and, technological advances, whether it's through genetics, whether it's through tests like this, that enable them to really be able to act, not necessarily alone, but in terms of to empower their own healthcare by looking at opportunities where they can help themselves versus, and really preventative, much more than maybe has historically been the model, certainly here in the US. And I think, that's what's going on in the rest of the world, looking at ways of how they try and prevent some of these, I guess, Western issues in terms of around obesity, diabetes. And so by looking at things like food sensitivity and working out which foods are good for them, which are not, and which are causing some of these concerns, those are problems, whether you happen to be, standing in London, whether you're in Atlanta, or whether you're in Mexico City. So I think that's what we're hearing, and I think that's why we're certainly excited to be operating, as you say, in a slightly scary world, because it's all changing. But I think some of those basic tenets will remain good for many years to come.
And it's something that I call good medicine. It's really a return to those personalized results, and I love that you're seeing what we all are hoping is happening, and I know we're seeing it in our practices, but it is. It's that return to kind of personalized medicine and very results focused, because people do want to be empowered, and they don't want to they realize that, hey, maybe what we've been told and just blindly believed before isn't the full story. So I love there's so much information, so much access, and so much great and evolving technology like what you guys use over there at KBMO. So James, for some of our listeners who maybe aren't going to be able to be at the summit in person, maybe they're streaming in or they're finding this on one of our social media channels, how can they find out more about you, about your testing, and be able to get signed up with KBMO services?
So certainly if they go to our website, which is www.kbmodiagnostics.com, then there's a way of, in terms of getting more information about the test, but also contacting us directly. We've got a pretty significant sales network in place now, so we have people in pretty much most states and major cities. So as I say, we can get back to people and in a very rapid way, and hopefully get them signed up, and hopefully they'll see some of the great impact on their practice that and for their patients that we're seeing in all over the U.S. right now.
And you guys, I want to be really transparent. Yes, KBMO is a sponsor for our event, but I went after them because I believed in them, because I believe and I've used their product in practice. So everything you're hearing right now isn't because I've been paid to endorse them. It's because I know how well it works. And I think a few things, if you're already using some other food sensitivity companies, it's worth at least giving them a call and looking, because, give them a try and see, so you can have the experience for yourself and begin to utilize and go ahead and see what happens if you're collecting insurance and doing those reimbursement rates. If you're still using Alcat or something like that, their price points are amazing if you're doing it as cash programs. So it's an affordable option. It's a valuable, viable option. And I think one of the other things that's so important, because the biggest challenge I've had as a practitioner, and I've used 4 different companies over just the last 5 years, and they've all come with their challenges, but I think the biggest thing industry-wide is turnaround time. And so for many food sensitivity results, my patients would be waiting easily up to 21 business days, easily, and sometimes even longer. But you all at KBMO your technology, not only is your sales force rapid and you have a great expansive network out there so that you guys can be timely with that, but most importantly, to us as practitioners and for our patients, you provide really quick, reliable turnaround time. I've gotten results from you guys in less than 7 days at times. So it's really significant, and I just want to thank you, James, because I think you guys have been doing a stellar job, and I'm so glad that we're going to get to have you at the summit next week. So everybody, thanks for tuning in today. Make sure you go find out more about KBMO, the fit test, and they've got some other phenomenal technology that we unfortunately didn't get to talk about today. We'll be highlighting at the summit, so you can go check them out over at KBMOdiagnostics.com. James, thank you so much, and we look forward to seeing you next week.
Thank you very much indeed, Dr. Melissa.
It was a pleasure. All right, everybody. Until next time, I'm Dr. Melissa. You know what to do. Continue to stay amazing.